It's so nice to meet you. Jim talks about you. Me and Jim work together, and he's just so wonderful. And he was telling me how he'll be joining you in Dubai in May. Is that right? Or did that happen already? Or
Oh, no, no. The May was what we hoped for, but it was too early for them. So we're still trying to schedule the training in Dubai.
oh, I see. And can
Yeah.
I ask you, what are you guys doing? Tell me.
Well, MAPS, the nonprofit, and I'm the president of MAPS, and I'm speaking on behalf of MAPS, not Lycos, the pharma company of which I'm on the board of directors. MAPS is a nonprofit, so we're going to try to go to where the suffering is, but where there's not that much money. So where the burden of trauma is the greatest, but where there's not a lot of resources. Earlier this morning, I addressed a group in Bosnia. So there's going to be a training in Sarajevo, and it's bringing 20 Arabic-speaking therapists, people from Bosnia, Serbia, that region, some from the U.S. And so what MAPS is wanting to do is global humanitarian projects funded by philanthropy. MAPS is also working on cannabis research. We have a $12.9 million grant from the state of Michigan to do a study in 320 veterans with PTSD. But the FDA has been blocking the study for several years, and they're refusing to let us study smoked marijuana or vaporized marijuana. And their entire critique of the vaporized marijuana was about vape pens, isolated cannabinoids in vape pens with oils that do have some safety issues, but we're not even planning to do that. And we weren't even saying we're planning to do that. So their resistance, I think, is political based on the kids vaping, all of that, and they're against tobacco smoking. So we're about to launch a formal dispute with lawyer scientists trying to overturn the FDA blockage of research into smoked or vaporized marijuana.
I'm so curious, in that population, you're looking at PTSD specifically and using cannabis.
Well, the idea for me is that MDMA-assisted therapy and psychedelic therapies in general are efforts to get at the root cause of things and try to make it so people can reprocess the trauma and then not need therapy after that. That's the goal. Marijuana for PTSD is like SSRIs. It's just about controlling symptoms. It doesn't get to the root cause. It's something that people keep using every day. On the other hand, a lot of people do use cannabis for PTSD. And right now, with the state legalization efforts and the medical marijuana states, there's a lot of people that are accessing cannabis for PTSD, but it's not covered by insurance. They have to pay for it themselves. So if we can take cannabis through the FDA, it would be tremendous for all of those patients that are currently having to pay for their own medicines. So that could be a 5 to 7 year thing. So our preferred approach is really get to the root cause, not just cover up symptoms. Now, there's another part about cannabis, which is important, which is that in our MDMA-assisted therapy for PTSD, we require people to taper off SSRIs. I shouldn't say we, I should say Lycos does that. MAPS is separate. And so it's difficult for people to taper off of their SSRIs. And a lot of people don't want to do that. It could be that as people taper off of SSRIs, they could switch to cannabis for controlling symptoms. And cannabis, you only need to stop one day before MDMA, and you'll still have a full MDMA experience. We actually ask people to stop SSRIs 5 half-lives plus a week to try to wash out the SSRIs. So we cannot do that in our research, but because people would have said, is it due to the MDMA? Is it due to the cannabis? What's the variable that you're looking at? So if cannabis can be approved for PTSD, it can be used for helping in the tapering. And even now, if FDA approves MDMA-assisted therapy for PTSD, people could use cannabis for the tapering process. So that could be really helpful. The other part is that MAPS is very interested in trying to take situations where there are regulatory complications based on politics that's blocking science. And so that's a real system right now with cannabis. And the concern is that if science can be blocked by politics, which psychedelic research was blocked for decades by politics, maybe there could be this repression could come back against psychedelics, where now there is psychedelic research without the blocking for political reasons. But the marijuana is being blocked for political reasons. So it's another reason for us to try to overturn the restrictions on cannabis research, because it's one more way to get politics out of the science and out of medicine. So it's a very important battle, I think. And what's interesting is that it's the same group that is reviewing MDMA, a division of psychiatry at the FDA, that's also blocking the marijuana research. So on the one hand, Lykos is trying to have a new drug application reviewed by the Division of Psychiatry. And on the other hand, MAPS is about to launch this formal dispute against the exact same division. But the sense that we get is that the division is not necessarily against what we're doing. The reason we get that is that there's a bunch of flimsy scientific arguments that they gave. Flimsy is another word for bogus about why cannabis couldn't be used. But when we reply with the science, what we see happening is that the FDA is no longer responding on the basis of the data. They're just saying no. So the understanding that I have from the political dynamics is that it's just a decision that the division doesn't want to make. They want people to make this decision at the higher levels so that they're not responsible for that decision. So we're fairly hopeful that the upper levels of the FDA will indeed overrule this blockage of the cannabis research, and that will open up the door to all sorts of research with cannabis as people are using it. Now, some people do use edibles, but it seems that most people that use it for PTSD use smoked or vaporized. So we should study what people are actually doing. And what's also happening in the background, which is going to be very helpful, is that the Biden administration is trying to reschedule cannabis from Schedule 1 to Schedule 3. And they're saying that they're doing that in part to facilitate research. So we've got this sort of overall context of the federal government trying to facilitate research with cannabis while the FDA is blocking it. And so I'm pretty hopeful for that. Now, MAPS also wants to do work with Ibogaine, and this is kind of like Ibogaine for opiate dependence. But what I'd like to do is do it in a different way with public money or donor money and try to do it completely with open science, without patents, and turn it immediately into a generic. I figure we're going to need to raise $80 to $100 million to do that. I don't have anybody has offered that, but some states that are getting billions and billions of dollars from Purdue Pharma and other people in the pharma industry for the damage they caused with OxyContin. For a while, Kentucky, with Brian Hubbard, who worked out of the Attorney General's office, he's tried to get $42 million from Kentucky to go for Ibogaine research. And that would be public money. So that gave me this idea, maybe we could do Ibogaine in this kind of open science generic way. In the end, a new attorney general shut it down. So Kentucky is not offering any money, but other states are considering it. So what I'm hoping for now is that we could find a donor that would say, I will donate $50 million on the condition that the states match it. And I think some states then might be willing to do that. Anyway, I think Ibogaine is a tremendous tool for the opiate dependence. It helps people go through withdrawal. MAPS is also doing drug policy reform. So, for example, at the U.S. Sentencing Commission, it's difficult to change the laws, but there's the U.S. Sentencing Commission is where the penalties are set if you break the laws. So right now, if you have a pile of MDMA in one hand and a pile of cocaine in another hand, you go to jail more for the MDMA than the cocaine because the penalties were made 20 years ago. I testified before the Sentencing Commission, as did Dave Nichols and a bunch of other people in 2001. We were completely ignored. And this was during the height of the hysteria over MDMA neurotoxicity. So the penalties were made under the assumption that MDMA is a terrible brain-damaging drug, worse than cocaine, and penalties have to be terrible. But over the last 20 plus years, these fears have shown to be completely overblown, that MDMA does not cause neurotoxicity in the doses that are used in therapy. Really, really difficult to defend against because the kind of neurotoxicity claims were, oh, we don't see any damage now, but 20 years from now, as people get older, now they're going to show these damages as you lose your cognitive reserves as you get older. Completely ignoring the fact that a lot of older people used MDMA without any problems. But it was always this way, this fear tactics. And so the penalties on MDMA were based on fear that the science has since disproven. Then we do a lot of public education work through the nonprofit. So we're very interested in trying to get accurate information to people. And we also have a whole series of harm reduction approaches. So Denver is the city that was the first one that made mushrooms the lowest enforcement priority. And so now we have a project with the Denver police to teach them about how to handle people with difficult psychedelic experiences, to not make it worse, not to escalate the problems. And so we're going to pilot this in Denver with several thousand first responders, and then we'll try to take this education to other areas around the country. So Colorado has legalized plant medicines as well. in an initiative. There's an initiative on the ballot here in Massachusetts for November to do the same, Oregon Psilocybin Initiative. So we want to go into areas where drug policy reform is happening with psychedelics and try to minimize the problems. There will be problems. So we want to train first responders, but we also want to teach people about peer support, how to handle the substance. The other thing is that when people tend to use psychedelics for fun, recreationally or stuff, they're really looking for a good time. And a lot of times, though, things come up that are difficult. And if people think, oh, this is just a party drug, it's not a therapy drug, and they squash their feelings down, they end up worse off, destabilizing themselves. They could be worse off for months or years afterwards. So I think the development of psychedelic-assisted therapy and the approval by FDA, hopefully August 11th is when the FDA has to tell Lykos if they approve MDMA-assisted therapy for PTSD. That's the deadline. They must say on or before August 11th. But then I think the more and more people will have this idea. These are tools. How they used is a variety of different ways, but that these tools can be used in therapeutic contexts. And so I think when people take them out of therapeutic context and they have difficult stuff come up, maybe they'll think, oh, this is an opportunity to work on this rather than something I just need to drink alcohol or I need to suppress it or whatever. So MAPS is doing a lot of public education like that. We also hold conferences. And so, we had the world's largest conference on psychedelics ever in June of 2023. We had 12,400 people at the conference in Denver. And we're going to do it again in June of 2025, also in Denver. And we're hoping for 20,000 people. And we hope that it'll be like a new world of prescription access to MDMA-assisted therapy for PTSD. And then people will think, oh, yeah, psilocybin could come next, 5-MeO-DMT could come next. We already have ketamine. I think there's over 3,000 clinics for ketamine in the country. But Johnson & Johnson that approved ketamine did it in a way without therapy. They just said, this is a pharmacological drug. And this is where you're saying we might have some work with physicians, because the worst ketamine clinics, which still can help people, are ones that give ketamine without therapy. And the better ones are the ones that provide therapy with the ketamine. And also Spravato is very expensive, and that's the patented version by Johnson & Johnson. But what seems to work more effectively is IV or IM generic ketamine, which is only a few dollars compared to hundreds of dollars per Spravato. But when you do that, it's even more important because it's stronger that you combine it with therapy. And so the better ketamine clinics do use IV or IM with therapy. So MAPS has a whole range of different kind of projects, including there's a project on conflict resolution between Israelis and Palestinians. That there was a small group, I don't know if they're meeting anymore, but there was a small group of Israelis and Palestinians doing ayahuasca and MDMA together. So Leo Roseman at Exeter in England has done really good studies with ayahuasca and took a group of Israelis and Palestinians to Spain and worked to try to help them feel their interconnectedness. And then from that, use that as kind of a basis for peace.
Goosebumps.
Yeah, it's really, really important. So we're going to try to do that with MDMA as well. Couples therapy, we're interested in studying couples therapy. It's not a DSM diagnosis, but it potentially could be, if the research findings bear this out, one of the better uses of MDMA. It's really good for helping people feel strengthened in themselves, to hear critical feedback, to be better listeners, to be more empathic, the oxytocin release. And so there's a wide range of things that MAPS is going to do, while Lykos Therapeutics is going to focus on building a business for MDMA-assisted therapy for PTSD.
So then the MDMA-assisted therapy, is that what Lykos is providing as a container with the medicine, or how does that work?
Yeah. The phase 3 designs were 42 hours of therapy.
Wow.
And you only get MDMA 3 times during that. So there's 3 8-hour MDMA sessions and 12 90-minute non-drug psychotherapy sessions, 3 for preparation for the first MDMA experience and 3 after each one for integration. So yeah, that's what Lykos Therapeutics is going to be working on, MDMA-assisted therapy for PTSD combined with therapy. So it's never going to be a take-home drug. It's only going to be administered under the direct supervision of therapists.
Beautiful, beautiful. And so and this model obviously works, and you guys have studied it at the FDA level, and there's been incredible results from this model. Now, the question that comes up in communities is the expensiveness of it, the financial considerations. How would Lycos, or how would the community, there's a tier of society that can afford to do that, or we can have certain people come through clinical trials, but they're limited. And so, what do you see in the future for us to be able to achieve with this, so we can, of course, insurance coverage is a part of it. AMA came out in May of 23, I want to say,
Mhm.
creating a CPT code for psychedelic assisted therapy. And, here we are as physicians, I'm one of the only ones that really knows how all of this works and how to do this. But majority don't know. Yeah, I'm just interested to pick your brain, how you see things move forward in this direction.
Well, yeah, the hope is that there will be insurance company coverage. That's what Lycos is working on. The other thing that's going to be important is looking at group therapy. And so there's a study at the Portland, Oregon VA by Christopher with Lycos MDMA. And it's the first experiment in the US. And it's going to be 4 therapists with 6 veterans with PTSD. And they're going to do 3 cohorts of that. So group therapy could be a way to reduce the cost. It's not clear what the outcomes will be from group therapy. My personal opinion is that individual therapy works better than group therapy, but the group could be very, very helpful with the integration process. And
Right.
that could maybe even not just make up for it, maybe get results as good as well. But I think the other third way to think about affordability is something that has not worked yet, but it's these ideas, these state level reforms, like in Oregon, where they create a whole system of people who are trained. They don't require licenses. Some do have them, but guides that they train, and then they can open up psilocybin clinics. And the people that could come to them are people that have a diagnosis or not. You could go for personal growth. That's the same thing that's going to be set up in Colorado, and if it passes in Massachusetts. But when you put these things to voters, they have this romantic attachment to plants. And you hear, oh, plants, how, people, marijuana is a plant. Somehow people were not, it's taken a while for people to be comfortable with marijuana being legally available. But when you add synthetics, MDMA or psilocybin, and the polling bears this out, that not as enough people vote for it anymore. So the state level reforms are working for plant psychedelics, but it'll be a while before MDMA is added to that. But what I've recently heard about is certain MDMA churches. And so what's been amazing is the incredible proliferation of psychedelic churches. And there's been virtually no enforcement. And I think it's the rise of the Christian right and the religious freedom to discriminate against people. And so I think the DEA is reluctant to go after psychedelic churches. And part of the reason also is that when you have over 100,000 people die from opiates and fentanyl overdoses per year in America, it's just devastating. 56,000 soldiers died in Vietnam. We have more than that dying every year, almost twice as much dying every year from opiate and fentanyl overdoses in the United States in 1 year compared to all the years of Vietnam, just as a comparison. So if the DEA puts resources towards going after psychedelic churches where there aren't claims of damage, they would be heavily criticized for doing that. So it's surprising, but there are a couple MDMA churches, and people can go in that way. But I think that the real question is going to be insurance coverage. I think that's the answer, and how that develops is we'll see over the next couple of years. But we're pretty hopeful.
Yeah. And I think once the pharmaceutical companies like Lycos, and tell me a little bit more about Lycos.
Well, I started MAPS in 1986. Thought at the time that there was no way that there was no intellectual property, really. That's what I thought, that MDMA would eventually become a generic right off the bat. And therefore, it needed to be funded by donations. So that was 1986. I get my master's in 1990. 1996, I took a class at Harvard Law School by Peter Barton-Hutt in FDA food and drug regulation. Eventually, I wrote my PhD on the FDA regulation of psychedelics, got my PhD in 2001. But it wasn't until 2014 that I realized that I thought I knew everything that was relevant in developing MDMA into a medicine. But there was one fundamental thing that I had completely overlooked. I'd never been taught about it because it's hardly ever used by the pharmaceutical industry. In 1984, Ronald Reagan signed the Waxman Act that had a provision where it provided incentives for developing drugs that were off patent. And these incentives are called data exclusivity. MDMA was invented by Merck in 1912. So MDMA itself is in the public domain. The uses, I learned about MDMA in 1982. It had been used as a therapy drug from the middle of the 70s till early 80s. It leaked out of that, became ecstasy, and that's what attracted the attention of the government and got criminalized. But people were using MDMA for PTSD before I even knew about MDMA. And so there's no way to sort of patent the use of MDMA for PTSD. I also saw in 1986, when I started MAPS, another company was started by Howard Lotsoff to develop Ibogaine into a medicine. And Howard did it in a for-profit way, and he got all these patents on Ibogaine for substance use disorder, for opiate use disorder. And then he started working with Deborah Mash for researchers. And it's kind of a more complicated story, but then a lot of people started suing each other for intellectual property, which doomed Ibogaine for decades. They never could raise the money. It was just so I contacted the attorney for Howard that had patented the use of Ibogaine for various things. And I said, I want to develop an anti-patent strategy so nobody could patent the uses of MDMA for anything. And that involves making it public. Somebody said, MDMA helped me for postpartum depression, or MDMA helped me for fibromyalgia, whatever it is. Then we put that story up on the internet, and now that's, quote, prior art. Nobody can claim they invented that idea. So we had an anti-patent strategy for the uses, and the molecule itself was in the public domain. So it turns out that this data exclusivity, it's different than a patent. What it means is that you have exclusive use of your data for 5 years. If someone wants to market a generic, they cannot do so for these 5 years unless they generate their own data. So that's how it's different than a patent. That if you have a patent, you're the inventor, you're the only one that can market it for that thing. But with data exclusivity, people just have to generate their own data if they want to. Now, it's also the case that if FDA does approve MDMA-assisted therapy for PTSD, Lykos is being required to do pediatric studies. And you're incentivized. You get 6 more months of data exclusivity for doing pediatric studies. So there was now, once I learned that, first off, I was shocked. This is 28 years after I started MAPS. I thought I knew all the important things, and it turned out that I had missed one of the very most important things, but it's because pharma never does it. They really want patents, they want a longer life, they won't invest all the money. So once I realized that there was this thing called data exclusivity, then I realized that I could tell a different story to donors, that I could say, MDMA for PTSD, MDMA may have other uses. And if I need to keep coming back to donors for money all the time, eventually you're going to exhaust these donors. But then I realized if we could use data exclusivity, create a monopoly, charge higher prices, and then use the resources for further research, then I could say to donors, help us get this first thing approved, and then we'll have an income flow to do all sorts of other things. So I started the MAPS Public Benefit Corporation, which was a public benefit for-profit company. Capitalism, which is about growth at all costs, is a bit like cancer, I would say. It's like growth without limits, and then often it can destroy the host. So the public benefit corporation is a modification of capitalism where you can put public benefit as one of the goals as well as profit. And in a public benefit corp, of which there's thousands of them now, minority shareholders cannot sue the management because they're not maximizing profits because they have public benefit goals. So I thought, here it is. We have a nonprofit organization that owns a public benefit pharma company. And I thought we will continue to raise all the money from donations, put it into the research through the MAPS Public Benefit Corp, and then we would be able to do drug development in a whole different way and market in a whole different way. What happened is November 2016, we got permission from the FDA to go to phase 3. So we demonstrated that it is possible to work through the FDA with psychedelic-assisted therapy. At least we were given the opportunity to demonstrate that. What happened then was the rise of hundreds of for-profit psychedelic companies. So MAPS has raised about 150 million in donations during our time. But once all these for-profit companies were around, and they started around 2017, 18, 19. It became more difficult for us to raise money from donors because people were like, hey, look at all these people trying to make money. Why should I donate? Maybe I can invest. Other people said, oh, let's just go for investment money. So unfortunately, in my view, we were unable to continue to raise the money from donors. We had to switch to investors. So Lycos Therapeutics was just recently completed a $100 million fundraising investment round, and it's now separate organization, and it does have this public benefit structure, which is really good. And there's been around $4 billion raised by for-profit psychedelic companies to do research in all different kinds of things. So that's really, really good. So one of the advantages, you could say, of taking investment money is access to capital. And so I'd guess that MAPS, Hefter, Council on Spiritual Practices, Beckley Foundation, maybe $300 million has been raised in philanthropy as compared to $4 billion from investor money.
Wow.
Yeah. So Lycos Therapeutics is now its own thing, and it, is moving forward. And that's the story.
Awesome. Awesome. And it's so interesting how the brilliance that comes with what you do, Rick. Wonderful. From so many different realms to create what you've created, to really, you've created a wave of raised awareness and education and consciousness and healing, conscious healing with figuring all these things out. And during this journey, have you had any mentors, guides, people that you do this work with? Because this is a lot. This is a lot to be done by a person.
Yeah, well, I'll say I do have. I'm very fortunate to have mentors. So let's go back to when I was 18 years old in 1972, and I was a college freshman, and I had seen the crashing and burning of the cities. So 1970 was the Controlled Substances Act, and all the drugs were criminalized. The counterculture was squashed. Nixon was elected. The war in Vietnam is just going forward. And it was this optimism and this hope that psychedelics would change things, and it was just destroyed. So I also, though, was very inspired by the going to the moon and the astronauts. And so some of the astronauts talked about how Edgar Mitchell, in fact, said that when you see the fundamental unity of nature, and it changes everything about how the way you think. And so I think they call it the overview effect, that you see the earth as one whole thing, and you don't see it divided by religions, languages, borders. You realize we're all in this sort of life together. And you can get that from this psychedelic mystical experience as well, or mystical experiences of any kind without psychedelics. And Einstein said that the splitting of the atom has changed everything except our mode of thinking. And hence we drift towards unparalleled catastrophe. What shall be required if mankind is to survive is a whole new mode of thinking. E.O. Wilson said that the problem with humanity is that we have Paleolithic emotions with medieval institutions and godlike technologies. So all of this made me realize that I was way overdeveloped intellectually and way underdeveloped emotionally and spiritually. That's our education in general is of the mind, not of the heart or the spirit, and that humanity as a whole was like that too, that we had these nuclear weapons. We had already, it was clear that we needed to move to renewable energy. Right now, it's obvious what we're doing with climate change and how humans are really good at procrastinating and people keeping their financial interests going, even in short term, even if it leads to disaster later. So that what I realized is that I really needed to work internally as a way to refine myself to be effective in making a better world. So I took a bunch of LSD and a bunch of mescaline. And I had the delusion that the more drugs you take, the faster you evolve. And I only wish it were true. I did my very best, but I ended up, super confused. And I went to the guidance counselor at college. Now, this is, again, New College, which was a private school at the time. It then later became merged with the state, and it had private funding to supplement the money that came from the state. And lately it's been destroyed by DeSantis as the most woke school in Florida. So he's fired the president, changed the board of trustees, destroyed the school, basically. And so it's really sad. There are still some students left over, but they're bringing in their control of the admissions. But in any case, I went to the guidance counselor. It was a different time. And the guidance counselor gave me a book to read. He said, it's important what you're doing, this work with psychedelics. It is important to balance with your studies or even necessarily at times to replace from your studies to work on this internal work. And he gave me a book to read. And this book was by Stan Grof, who was the first major mentor. And it was Realms of the Human Unconscious Observations from LSD Research. But what was so shocking was that the book wasn't published till 1975. So my guidance counselor had the book manuscript copied directly from Stan.
Wow.
And I'm reading this book, and this is where everything came together for me, because Stan used a scientific lens to talk about the realms of the human unconscious. And he talked about 3 different basic areas: the Freudian, which he called biographical, the things that happen to us, and Freud, I think, is like Columbus. He discovered something, but he got the map all wrong.
Right.
He discovered something really big, but, he drew the map all wrong. Then the middle section, middle, was called Otto Rank. He was a Freudian, but he started believing that the birth trauma was something that was a major importance. And under LSD, a lot of people did get to these states of re-experiencing their birth. And then the third area was Jungian, transpersonal psychology, the ways in which we're all connected. Stan talked about this, and the Jungian is where you talk about spirituality, mysticism, different kinds of consciousness. This was all looked at through a scientific lens, which made me trust it. I didn't really trust religion, but I trusted this scientific lens. And there was a reality check to the whole thing, which was therapy. You can have all these spiritual theories and you can have all of this ideas, but can you use them to actually help people get over depression or anxiety or fear of death or addiction? So this package of what I read in Realms of the Human Unconscious felt to me like this has been squashed. It's been squashed by Nixon for real good reasons, because he was fearful that the more we feel connected, the less we're going to want to go kill people in Vietnam, or the less we want to be racist. And Nixon was a big racist. So I felt this was really, really inspiring. And so I asked the guidance counselor if I could write a letter to Stan, if he could send it to him, to ask him how I might become a psychedelic therapist. And okay, so keep in mind, I'm a confused 18-year-old college freshman who's done all LSD and mescaline and doesn't know. And Stan was now MD, PhD at Johns Hopkins, but his LSD research was being shut down. And so he was having to leave. Everything was being crushed. So I did send this letter to Stan. And to my shock, he wrote me back. And he invited me to a workshop that he was giving in the summer of 1972 out in California. I hitchhiked across much of the country to get there. And I did a workshop with Stan in 72. And then after that, I did a month-long encounter group up in the mountains, kind of, again, working on further aspects of refining myself. And then I did primal therapy, which was a 3-week primal intensive where you're isolated. You only come out 1 hour a day in a soundproof padded room to kind of get to the primal birth trauma. And I did that. But in the end, I wasn't really where I wanted to be. I had basically neglected the whole idea of integration. I just thought, go out, you have these experiences, and and more is better, stuff like that. So that did not work, and I ended up feeling very unmoored. And so then I decided that to get grounded, I needed to start building things in the physical world. So Stan became this mentor of me, but for 10 years, I had no connection with him or with anybody. And I just was reading all the books on psychedelics, and every once in a while, I would trip, usually with lower doses, trying to kind of work through my fears of letting go, fears of ego dissolution. And finally, after 10 years of that, I was ready to go back to school at New College, where I started. And my first semester in September of 82 was to Esalen, a month-long workshop with Stan and Christina Groff called The Mystical Quest. And so I went out to Esalen, I got college credit for it. And that's where I learned about MDMA from someone who was not in the workshop, but came to Esalen, and a woman, Debbie Harlow, and was talking about this drug MDMA. And I was really interested in it. But the way she described it helps you feel love, helps you feel connected, helps you experience your emotions, better listener, all this kind of stuff. And I kind of discounted it. I'm like, hey, I am in love. I have a great girlfriend. I'm very much a good listener. And then I saw a group of people sitting in a circle doing MDMA, talking to each other. And from the outside looking in, I was like, they're just talking. You know, you take 250 micrograms of LSD, you can't talk. Well, this is really probably not very important of a drug. So I like to say that I was stupid enough to underestimate it, but smart enough to buy some. And so I came home and took it with my girlfriend, and I was absolutely shocked how profound it was. It was just incredible. So then I'm going through school, and I'm getting to my next mentor through this. So then I go through school, and I developed a curriculum on what it takes to become a psychedelic therapist. And basically, I found it overlapped with transpersonal psychology. If you study transpersonal psychology, and then you have some special classes in psychedelic research, that would be the best training. I did have my dad's a doctor, my brother's a doctor, and I looked at whether I wanted to become a doctor, but I decided that the training you get for psychiatry is mostly beside the point. It doesn't really help you be a therapist. And yeah,
Terrible. It's terrible. There's no human connection.
it's all about you're an arm of the pharmaceutical industry.
That's it.
Let me give you this medicine. Let me give you that medicine. And so I decided to scrap the part about going to medical school and just focus on the psychotherapy. So then I graduate in 1987 from New College, and I want to get a clinical psych PhD. And the idea then is that I would learn how to do psychotherapy outcome research with MDMA. Now, MDMA had been criminalized in 1985. I started MAPS in 86. 87 is when I graduated school. And so I'm telling these graduate schools that I want to study MDMA-assisted therapy and do psychotherapy outcome research. And so nobody would let me in. I did really, really good on the GREs. I had great recommendations, but I just couldn't get in. I was confused. Like, this is now since 1972. Now this is 1987, and my path is blocked. And so I went home, and I decided I would think about this situation while I'm high on marijuana. That would give me a way to think creatively. I should just diverge by saying that MAPS has what we call smokable tasks as part of our employee manual, that people can do drugs at work. And a smokable task is something that you and your manager thinks you do as well or better when you're high. So strategizing is a smokable task. Brainstorming, all these kind of things, creative thinking. You need to do that in work a lot of times. So anyway, I'm sitting at home, I'm smoking marijuana, and I'm thinking, what am I going to do with my life? I'm blocked from getting clinical psych PhD. And so I had this feeling that I have this pattern of I want too much too soon. And I said, okay, in this case, the science is being blocked by the politics. So what that means is I need to study the politics in order to get to the science. And I had read an interview with this guy named Mark Kleiman. So he's my next big mentor. And Mark Kleiman he's a drug policy expert. And he talked in an interview in Harper's Magazine with a couple of people about drug policy. And they mentioned the lawsuit that I had initiated against the against the DEA back in 1984 when they tried to criminalize MDMA. And so this guy, Mark Kleiman, was at a school I'd never heard of called the Kennedy School of Government at Harvard. I hadn't studied public policy, really, just studied psychology, transpersonal psychology. So I called him up and I said, I need a mentor to figure out the politics. If I can get into the Kennedy School, would you be my mentor? Would you teach me about drug policy and teach me about how I can open up the door to psychedelics? And he said, yes, he would be my mentor if I could get in. And so I managed to be I'm a beneficiary of affirmative action. I was the token left-wing hippie of the year that they let into the Kennedy School. And so I studied with Mark quite a lot. So Mark then became my mentor in how to maneuver through political systems related to drug policy. So that was my main mentor. Then I got into, I got my master's in 1990 at the Kennedy School, and I was trying to see how legit I could be. And so I applied for what's called the Presidential Management Fellowship, or it was Presidential Management Internship at the time. Now it's called Fellowship. It's for people that want careers in the federal government. They pick like 150 people a year, and you have to go throughout the federal government. And every month or two, you come together for special leadership training meetings, and you meet people in all the different areas of the government, and you can do cross-departmental collaborations, things like that. So I applied for that, and I managed to get it. And so I applied for a job at the FDA. And my application I did not know this, but in late 89, early 1990, FDA created a new division to experiment with how to improve drug development to speed it up. People from the AIDS community, ACT UP, were really upset about FDA when people are dying right and left from AIDS, and the FDA is very slow to permit any kind of research to go on. They're overly focused on avoiding risk and not enough on this benefit side of things. So anyway, my application and this group, the pilot drug evaluation staff, and they looked over the different FDA divisions, and they needed drugs to review, and they got all the Schedule 1 drugs, all the psychedelic drugs from the group that had blocked research for 20 years. And so my application ended up with them. And so I was so excited. Now I can get a job at the FDA. I can learn how FDA works. And I went through 6 months of vetting to even meeting with the head of CDER, the Center for Drug Evaluation, the guy in charge of all drug research at the FDA. And they decided that they would hire me. And I would learn the ideas. I'd work for a couple years at the FDA. Then I would go back out and bring projects to them. And I was willing to do two things that, if people know me, very hard to do to get this job at the FDA, which is I was willing to wear a suit and tie to work if I had to do that. And I was also willing to give up drugs.
Wow.
In order to work in a federal system. So fortunately, the Drug Enforcement Administration saved me from giving up drugs. Because at the last minute, right before I was going to go to these final interviews, the DEA heard that I was being interviewed for this position, and they told the FDA they would refuse to work with me because I'd previously sued the DEA and had won the lawsuit trying to, even though in the end, DEA criminalized MDMA, but we won this lawsuit. So then I could not get this government job. So then I decided I needed to get a PhD and I needed more credibility. Okay, so now we get to my third mentor, which is a fellow named Peter Barton Hutt. So he taught a class at Harvard Law School that I took in 1996 on food and drug regulation. He used to be the lawyer for the FDA. He's the premier FDA regulatory expert in the United States. He's in his late 80s right now. He's brilliant. He wrote the textbook, Food and Drug Regulation, and then he became on my dissertation committee. And so I learned a lot from him about how FDA works. Meanwhile, I've kept the relationship with Stan Groff. And so he's been sort of my continual mentor in that. And I learned from 88 to 90, when I was getting my master's degree at the Kennedy School, I was also going through training with Stan and Christina in holotropic breathwork in the first group that they trained, 2 weeks every 6 months for 3 years. It was incredible training. It was the first group to be certified as a holotropic breathwork practitioner. So I sort of have this parallel training of inner work and outer work. And so what I think about it is it's about working with individuals in psychotherapy, and then it's about working with culture where you've got sick public policies. So those were I'd say the main mentors that I had. The other thing I should say is my parents. And so this was just a remarkable thing. So when I was in 1972, when I'm 18 and I read Stan Groff's book and I realized this is really important, what I decided then is that I'm going to drop out of college. Now I'm the oldest of 4 kids. So I'm the first to leave the nest. So in the middle of my freshman year of college, I call my parents and I say, you know what? I'm so overdeveloped in my mind. I'm so underdeveloped emotionally and spiritually. I want to study LSD. And I'm going to drop out of college, and I want you guys to pay for it. And the first thing I wanted them to pay for was this workshop with Stan and this primal therapy and the encounter groups and things like that. And it was difficult for them, but after a couple months, they said yes, they would help me. And my parents were tremendous. They said that we think you're a stubborn kind of a guy, and if we say no, it's going to take you longer to realize it's a mistake. And once you realize it's a mistake, you're not going to want to admit it because then your parents are right and you're not. And then they said, we have a tiny, tiny shred of doubt. Maybe you do know what you need to do. And so they said yes. And so that was just sort of a mentorship in love and sort of unconditional love. And so those are my main mentors, I would say.
That's incredible. And they were open, and you were open to them and sharing and receiving from them and asking.
Well, I think the way I understand it now is my grandfather was an immigrant, came over from Poland in 1920. And my grandmother had come over from Poland before. They were very poor. They had a bookstore. My dad learned how to read a book without breaking the spine so they could sell it after he had read it. And from the time he was 4 or 5 years old, he knew he had to be a doctor. That was kind of the way out of poverty. He was an only child. And he enjoyed being a doctor, but he basically said that he would raise his kids in a different way. He would try to find out what we wanted to do and help us do that.
Incredible.
Yeah.
So that's a whole different story than a lot of doctors nowadays who push their children in becoming doctors. In my household, it's different. My daughter says, I want to be a doctor. We're like, no way. Go be an animal doctor. That's cool. Human doctor nowadays, it's an industry and the humanity is out of it. And so it's really incredible that they met you where you needed to be met for your development. And that support is everything.
I was so lucky. Yeah.
So lucky. Are they still around, your parents?
No, my dad um died in 2022. My mom died in 2020. But they were both into their 90s. So, they had a full, really good life. They both died at home, which was really
Oh,
nice.
beautiful.
And actually, I feel their presence more than I feel their absence.
Incredible. Yes. Did they ever try out these different
That's where I failed completely. They didn't drink, they didn't smoke, they were very straight in those ways. And so, no, there was only one time when I was home that I got my mom to smoke marijuana, but it was because of pain. She was in a lot of pain. And so she was willing to try a bit of marijuana. It helped her a little bit, but once I left home, she didn't keep it up. But I could never get them to try MDMA.
Mm.
But there was one story that changed their attitudes a lot. So this was now 1987, before I'm going to graduate new college. And my grandmother fell into a depression. And she'd had one earlier, 25 years before, something like that. And she'd gotten electroconvulsive therapy and it had actually helped her. And then she was fine. But then she fell into a depression again. And she got 2 courses of ECT and it didn't help her. And it um, damaged her memory. She didn't like it at all. And she just decided that she would rather die. And so I spoke to my parents and I said, let's give her MDMA. But now this was after MDMA had been criminalized. And my parents were a little bit weird about it. And they said, well, you can do that, but only if it's legal. And I'm like, well, who cares? I mean, nothing's working. But so I tried hard to get approval, but this was at the time when FDA was blocking all the research. So I couldn't get approval. And so I thought, well, what can I do? I was pretty close to my grandmother. So I thought, I'll try the contact high. I'll take MDMA and spend the day with her and see if I can bring her out of this depression.
Brilliant.
Yeah. And so what she said was, I don't want to leave my room. I don't want to see my old friends. Life's a misery. I've accomplished everything I want to accomplish. There's nothing left to live for. Everything is agony, and I just want to die. And so when she's sharing that with me, and I'm under the influence of MDMA, I'm hearing all that. But what I heard was also, you've accomplished everything you want to accomplish. So I said, that's terrific. Let's celebrate that. Everybody dies. Not everybody accomplishes everything they want to. It's a wonderful thing. Let's sort of be positive for a moment and say, great, you accomplished everything you want to accomplish. I've not. I've got this whole list of agenda things I want to do that I haven't done. And so that shifted her mood for a moment. But then she said, let me show you something. She went back to her room and she came back and she had this book, and it was the Song of Songs. This illuminated. Now, the Song of Songs is the most erotic part of the Bible. And the rabbis have said this is the love of God for the Jewish people. But when you read it, it does not sound like that. And she explained that this was a wedding present, that she had a romance before my grandfather that her parents didn't like. They'd gone from Chicago to Palestine, and they had, in their 60s, her parents, and brought their 3 kids. She was one of them. They built a house on Rothschild Boulevard in Tel Aviv. It's a historical site right now, this house. And my grandmother was there with her siblings, and she started this romance with somebody that her parents didn't like, so they shipped her back to America. And after that, she met my grandfather and they got married. And so this was the wedding present from the guy she had a romance with. And nobody had known that. She had kept the secret for over 60 years. I don't know if my grandfather knew it. He probably did. But she had saved this book for over 60 years. And as it turned out, once I told my parents the story, inside of it was a note and a rose from this guy with the book. And so when I told my parents about it, it explained family history. We got all these relatives in Israel, but my grandmother's here in the US. And how did that happen? And it was because of this romance in part. So a buried part of family history came under the influence of MDMA. And that's what really solidified this change in my parents' attitudes, that I was onto something.
Wow. And for her to have kept this secret for so long and this heartbreak event
Yeah.
that she had kept for so long that she got to share with her grandson. I mean, how did that change for her? Did anything change after that for her?
No, no, it didn't. Well, what was difficult was my aunt and uncle came to check on us. They didn't know I was doing MDMA that day, but they came to give me a ride home and check on us. And when they heard the story and saw the book and everything, they said, give her MDMA right now. This is incredible. But my aunt was my mother's younger sister, and my mother had said no. So it was this real big dilemma. And I also know by this time I'd learned about integration. And I know that you can give MDMA to somebody or any kind of psychedelic, but they're going to need support during the integration process. And if my parents were all against it, and if it was all, so in the end, it was one of the most difficult choices, I would say, of my life, whether to give it to her then or not. But in the end, I did not do it. And shortly after that, she just decided she didn't want to live, and she stopped eating and drinking and died.
How old
So
was she at the time?
she was about, let's see, I think she was in her mid 80s. So,
Yeah,
yeah.
yeah, yeah, yeah. But how special to be able to have even just that one experience with her. How
Oh,
special.
it was wonderful. And when she died, I inherited the book and the note and the rose. So I have that.
Oh, how wonderful. And Rick, you bring up such a beautiful point. I'm an internal medicine trained physician, board certified, worked for a large academic institution for a decade. I was an academic hospitalist, saw all kinds of things, learned a ton from the most underserved population in the US, in New Mexico. And now shifting to hospice and palliative.
Oh, wow. Great.
And, we're building this practice and we're all in the space of course, we're going to provide medicine, as things become legal or, and I have some contacts with the state as well to maybe even get, some kind of an exception for this practice to move forward with it sooner. But I see it not only MDMA, but cannabis.
Yeah.
And, LSD is a tough one. Me, myself, LSD brought me to the point I am today. And of course, life experiences, but it was a high dose LSD experience in the desert when there was a huge storm. We were at Burning Man and I needed a shift. I had called to the desert to show me my way back to myself. And that's how I created the conscious physician method. I was extremely burnt out as a physician and it was very dark, had suicidal ideation, all kinds of things. And, along parallel, just like you were saying, was always on a spiritual path of figuring out what am I? Who am I? What am I about? What is my purpose? What gives me meaning? And the Western practice of medicine was crushing my soul. It really, through the really bad, dark places, I was in depression for about 2 years and complete burnout. And I didn't know where it was. And you brought up source of your suffering. What is that? I couldn't figure it out. And I had been using psychedelics in a safe space, but not in a therapeutic
Mm-hmm.
space of intentionality. In my culture, I'm from Iran. Yeah, in my culture, growing up, drugs were bad. Look at them, people lose their minds, they shatter their lives. That's the kind of thing I grew up with, that kind of mentality. Now, looking back, my culture is very psychedelic, and psychedelics were used all the time in my culture. And even the Shahs, before taking oath of office, Alexander the Great, he had a ceremony, he had a psychedelic ceremony, a hero's dose. Don't exactly know what was in it. Maybe Homa is, what we're seeing archaeologically be present. And, when he went to capture Babylon, he captured Babylon and he went and kissed the feet of the statue of the god that they had in their square, saying, you guys have this beautiful culture. You need to protect yourself better. And then he made Babylon the capital of the Persian Empire at the time. So That's the kind of culture I come from. And then this religious dictatorship, this terrorist regime came and has severed us from that being female is bad. Period. The oppression, the suppression. And so these psychedelic journeys really showed me the way to where my traumas were. I grew up in a very loving family and I lived in war for the first 8 years of my life. Talk about birth trauma and prenatal trauma. I've been listening to The Way of the Psychonaut by Stan,
Oh, oh.
and he goes into depth of all of that. And my mom this past year was telling me how when she was pregnant with me, they would go down to the shelters when they heard the city alarms go off, and she would feel me as a fetus in her belly shake
Mm,
every time
oh,
a bomb would drop. And so recognition of that and honoring that, I have gone through this. And so, yeah, I'm going to feel this unsettling in my nervous system, right? Because it's prenatal. And I grew up in that culture and in that country under those pressures for 14 years before we came to the US. And it was during my LSD trip that so much of that was separated, the fears of living, separated away from me. And I was able to see it. And I created the conscious physician method from that. And now I'm helping a lot of professionals throughout the world with this method. But it's incredible that each medicine truly has its place. And, MDMA is just love,
yeah.
truly just love. And the fact that you're bringing love to humanity, back into humanity, and taking it to places where trauma is alive. It's the most tremendous service to humanity that you can give, and you're doing it. And you're like, yes, obstacle, I'm going towards it.
Yes.
You love that. You're like, I can't do it. Okay, let's do it. That's incredible.
Well, when I was 21 to 23, I raised an Alaskan timber wolf that I actually got 8 weeks old from the Humane Society. They'd shut down this wild animal breeding operation. Lycos means wolf in Greek, so that's where they came up with that name to sort of honor this part of their founding in a way. But I learned a lot from this timber wolf about this idea of this confidence and this straight ahead. You're the top predator. They had enormous energy. So where there's an obstacle, they just go over it. They don't go around it. They go through bushes. They just are just like straight ahead kind of thing. So I learned confidence, and I learned go for directly what you want. I learned a bunch of really good things from that wolf. And eventually a space opened up in a sanctuary with a female wolf that needed a mate. And so but I used to live at the edge of town, and there was hundreds and hundreds of acres of land, vacant land. And I could just run with him through the woods off a leash. And we would just cruise, and different friends would come along with us. And so it was like a wolf pack. So I really spent enormous amount of time um, learning from the wolf. But that's, I'd say, where a lot of this thinking came from, about seeing challenges as obstacles, but as opportunities for exercise. And then I feel like I've got so much privilege that it's in order to give me the support and the strength to do what. Okay, I'm gonna just show you this here.
Are you serious? That
Yeah,
is
that's
amazing.
yeah. So that's my wolf and I.
Oh my gosh.
And this is in the woods behind the house. And yeah, this is one of my favorite pictures.
I mean, you guys are definitely in the same space. You look at those eyes, you're
Yeah, yeah. But
glowing together. What was his name?
Phaedrus. So there was a book called Zen and the Art of Motorcycle Maintenance, and it was a real interesting book. But the person's alter ego was Phaedrus, and what he said in the book was that Phaedrus was the Greek word for wolf, which he got that wrong. But that's what I thought. And Phaedrus is a character in the Plato dialogues. And Phaedrus is a person from the country, and it's in a way about the taming power of love, of how you come in from the countryside, and he's learning about love. And so that seemed like a perfect name for this wolf.
That's incredible. What
Yeah.
an experience you took on. Here's a wolf. I will take it. Right now we have a wild field mouse that I'm raising, and it won't leave my hands. It is the cutest little thing. It's like 2 weeks old. My daughter found it
Oh.
at school. She brings it home. She's like, Mom is going to love this. Wild little animal. And it's, there's truly a love and a connection and an unconditional love that you feel with animals in a way that You don't have to pretend anything else with them. It's just they are what they are and they accept you for what you are. And as long as you have that heart connection with them, that's it. Um,
Well, here, I'll see if I can.
I want more wolf stories, Rick.
Well, I'm gonna try to show
So
you
where
one
did
more.
you live in a home? Did the wolf come in?
Well, no, no, I was not able to house. He couldn't be housebroken. He had just incredible spirit. So I ended up building a big pen for him outside. So here is one more.
Wow.
So he was totally trustworthy. I mean, just incredible. He never hurt me. We would wrestle a lot, and he had all sorts of energies like that. So he would try to jump up on me and push me down. As he's flying through the air, I would try to catch his back paw and flip him on his back. And we do this in the dark and, like judo or something. He would come at me from different angles and stuff. And so we used to wrestle all that. And this was the house I built in the back. You can see.
Oh, for him.
No, no, that's for me.
Okay.
But he had a pen right outside there.
That's incredible. This is
And
incredible. You jujitsu'd with him.
oh yeah. Okay, this is actually a good story about my dad too, since I talked about him. So after I gave him up, the wolf sanctuary, I was in Florida, in Sarasota, Florida, and the wolf sanctuary was up near Washington, D.C. And I would go visit him, once or twice, a couple times a year, just to be there and to take him out for a walk and howl with him and do different things. The female wolf that he was with had been captured in the wild. She was older than he was, and she hated people. And so the person that had the wolf sanctuary would be the only one that could go into the pen and get him, Phaedrus, out and bring him to me, and I would go for walks with him and stuff. So now it's 2 years after I gave him up, and he's I go up there to go out, take him out for a walk. And Ruffin Harris was the guy that had the wolf sanctuary. He had a glove on, and he had a chain, was the leash, was like a chain link leash. And he went to go get Phaedrus, and I heard this growl. And I assumed that this growl was Phaedrus against this female wolf, saying, no, he's going to go with me. She doesn't want him to be with me. But so that's how I interpreted this growl. And then Ruffin brings him out to me. He's holding the chain wrapped around his hand, and I'm petting Phaedrus, and he doesn't welcome my touch. And I'm like, this is sort of something strange. And I said, I've been away from him for a while. I need to reestablish my dominance. The alpha male and alpha female wolves eat first. So I would always lick his food. I gave him chicken necks and back. So I would always lick his food before I gave it to him. So there's all these different ways that it was clear I was the alpha wolf, or I tried to help him think that. And so I get 6 feet away, and I'm over him, and I'm staring down at him, and I'm thinking, okay, this is the way to establish my dominance again, and then I'll go out for a walk. And he's looking at me like he sees right through me. His eyes glaze over. He's he's just like looking past me. And then I see this kind of ripple go through his body, like he's tensing his muscles. And internally, I think, this is not going well. I don't think I've reestablished my dominance. And all of a sudden, he leaps at me as fast as he can. And he does it so fast and so surprising. He pulls the chain out of the guy's hand, and he's coming right at my head. Now he's 2 years older. So 4 years old is where around the time in the wild they can find their way in the pack. They challenge the old wolf. So he's coming right at me, and I'm a little bit out of practice for this kind of wrestling. And so the thing is to try to catch his jaw by the side of it so he can't turn around and bite me or just tag me, and then to get his back foot and pull him over. But I was out of practice. So I do this, and he gets my wrist right in his jaw. And so he's sort of sailing by me. He crunches down just to say, I could break your wrist. I could do this. And then he lets go. And then he's off. And then Ruff finally catches the leash and takes him away. So he challenged me for dominance because he did it in a way. Wolves are better than humans in certain ways, is when they challenge the old wolf for dominance, they rarely kill the old wolf. Sometimes, you hear about a lone wolf, they're sent out of the pack, but a lot of times they'll find a new way in the pack. They're no longer the leader. Now they're part of the pack, and there's a new leader. So I was just super sad because I knew I couldn't be with him anymore because he so took me as another wolf. I couldn't really wrestle the way wolves wrestle, the way they do that once they're really struggling for dominance. So I was super sad. It was the end of an era, and I was crying and just sad. And I decided to call my parents and just tell them what happened. And I told them this whole story. And my dad said, "What's the problem? You did it to me." And I was like, you know what? I did. And you're right. What's the problem? He's his own wolf now. I should be happy. He's his own wolf.
Wow.
Yeah. So I was never able to be with him again, but he was his own wolf now. And the growl was against me, not the female wolf. And
Wow, how incredible! How
yeah.
incredible! And nature, right? Nature teaches us so much. I have this ring. I don't know if you can see what
Yeah.
it's a shell.
Oh,
It's a shell.
oh, pretty,
I got
beautiful.
it. Thank you. I got it recently in Costa Rica. I have very tiny fingers, so not much, sticks on. So I put this on, and it was perfect. And it really is that. It is my promise to nature that
Mm,
we need to better humanity and we need to work through our traumas so that we can give back to nature the way nature deserves to be treated.
yeah.
Well, I wear this ring very often, reminding myself of why I do what I do. And yes, it's challenging. And yes, I got to keep being consistent and working on it, but we have to. I mean, look at this. What you just shared is fantastic. What you learned from nature, from this wolf, like the moments, the hours that you spent with him, the things you learned about yourself is beyond any human that could teach you. If we honored nature and we were more in tune, just like you are, with nature more, how harmonious this world would be. But I'm also very curious. Do you have anything else to say about this experience? And then I want to
Um,
ask you some other questions.
I'll just say that, I was very shy and I asked for the most dominant of the litter. So that there's a litter of 8 wolf cubs that the Humane Society had. So I got the most dominant of the litter, at least what they thought was. And it just taught me enormous amount about confidence. There's one other very fast story is that I had a whole big supply of LSD at the time. I was worried about the police. And so a friend of mine stored my LSD stash at his house, family guy and stuff. And he had a barn and he had a big Doberman. I got to know this Doberman, but he was kind of a guard dog. And so one day I went over to get some LSD, but my friend wasn't there. And the Doberman was in front of this freezer in his barn, standing right there. And the Doberman wouldn't get out of the way. I wasn't able to get my LSD. The wolf was only like 4 months old at the time. And so I thought, maybe I'll see what Phaedrus can do. So I get Phaedrus out of the car, let him off the leash, and he just wanders around. He notices the Doberman, and he goes to the Doberman, who's like 4 times his size, just steps on this Doberman, and the Doberman is like quizzical, and just gets up and walks away. And I was able to get my acid stash to trip that day. But it was just this confidence of, and
Wow.
curiosity, and it just freaked out this Doberman.
Wow, that's incredible.
And I
That's
just kind of learned about,
Yeah.
how he was. And here's another thing is that I think about him very frequently because in civilization, there's paths, there's sidewalks, there's all these ways, concrete sidewalk stuff. But often they go around a ditch or they're not always the straight, direct path. And so this straight away I would learn from the wolf. And so if I go through a ditch, it's just a little bit extra work, but usually I can end up faster to a place than somebody that goes the long way around it without that much extra energy. So just this abundance of energy, they run, 6 to 8 hours a day. They can just enormous or more. And so I just learned that straight ahead kind of idea.
Straight
And
ahead. And the buffalo, that's what they do in a big snowstorm. They go straight through instead of trying to avoid it because they know
wow,
it's the fastest way through.
wow, I
This
didn't know that. That's great.
Yeah,
Hmm.
yeah, yeah. Thank you so much, Rick. Thank you so much for your time and your energy and what you do. I do want to talk to you at a later time about potential work together, maybe in Iran,
Well,
maybe.
exactly. So actually, I've been thinking about that because there's a woman that works with Andy Weil that is from Iran, speaks Farsi. There is a thought of how can we bring this to Iran? Is it
I
even
got you.
possible? Well,
I
we
got
would
you.
very much like to bring MDMA to Iran. There are underground MDMA therapists in Iran, but yeah, I would love to talk to you about that.
Let's talk. Let's talk. And as we do this work, please mentor me in all the ways possible. But yes, it's I have a connection at the University of Tehran.
Really?
So, yes, I'm hoping to get that connection going, maybe put a meeting together. We'll all meet. I'm happy to help in whatever I can to bring this work in with therapists, with whatever, and I have a method that I also created for physicians to become to be able to bring psychedelics, any type of psychedelic. The book I wrote, which I got best-selling author for, is on psilocybin. It's called The Conscious Physician Method, Conscious Life Practices. And
Mm.
psilocybin, these are integrative methods plus psilocybin. Psilocybin is just one that I'm more comfortable with. I also use MDMA with my clients. And it's wonderful. But I'm happy to work with you in whatever shape or form it manifests to bring this work. We really, really need it, especially Iran. You know, Iran was known as the heart of the world in the ancient times. And then it got this cancer of a religious dictatorship that's terrorized us for the past 45 years. And the intergenerational trauma is beyond repair if we don't do something like psychedelics. You know, we bring that work to the population. So how do you want to go about this? Do you want me to
Well,
just
I just
a
sent you
little?
an email. This is from this woman in who studied with integrative medicine, Andy Weil. So
Okay,
you'll see she just sent this. I haven't even had a chance to reply to her. Just sent it to you, and you can see she outlines different ideas for helping in Iran.
love
So
it.
I would, we can get MDMA from Canada. We can try to train. Well, right now there's a training starting tomorrow in Sarajevo. And
Mm.
there's 20 Arabic speaking people at that training that were trained with people from Ukraine, from Bosnia, Serbia, Croatia, things like that. If there is the possibility of doing a small pilot study at the university, we could try to help in any number of different ways. And in fact, we are trying to do a training in Abu Dhabi and Dubai for people from the Arab region. I don't know if Iranians can go to Abu Dhabi or Dubai, but
Some go. You know, I don't think you need a visa, but you know, people do go.
okay. So maybe if you can reply back to me about what you think about the email I just sent you.
Perfect. I will look at it right now.
Okay. Okay.
Rick, thank you
Great.
so much. Thank you for all
Yeah.
you do. And your journey is so beautiful. Thank you for
Well,
sharing.
yeah.
What a
Thank you for
privilege.
having me. Lita, I'd love to, if we can bring MDMA to Iran, that would be amazing.
Dream come true. But you know what? I'm going to take your advice and your wolf's advice, okay? We're going to go straight for it. We're going to go straight for what we want because it's the right thing.
Yes. Yes.
Yeah.
Yes. Yes.
Yes, truly. Awesome. Have a beautiful
Okay.
rest of your day, Rick.
Thank you. Oh,
Bye.